Good evening, welcome to Left, Right and Centre. I'm Vishnu Shom. The big story that we continue to track, COVID. And I think the biggest concern on the minds of people in all parts of our country, particularly Maharashtra now, given the numbers, is that if I fall unwell, will there be a bed for me in a hospital? If I get even more unwell, will there be oxygen which is available? If it gets even worse, what about a ventilator? Very much the last line of saving anyone's life. At this stage, the availability of hospital beds in Mumbai is going down. That's going to be our first topic. Is Mumbai staring at a shortage of hospital beds? Should point out, we don't want to alarm people. There are plans to get many more beds. And we'll be discussing that as well. But at the moment, it appears fairly difficult, fairly challenging. Now that's going to be topic number one. Topic number two. And here's a real concern. With the humanitarian situation in Myanmar now progressively out of control, does India, as the world's largest democracy, have an important role to play? I ask this at a time when this letter from a senior Manipur government official to district commissioners says the district administration should not open any camps to provide food and shelter to refugees trying to come into our country because they are afraid of the military junta on that side. Is this right? What role does India, as the world's largest democracy, have to play over here? But first, let's take a look at the overall COVID numbers. I'll be joined by the senior Congress leader, Milind Deora, in a few moments. But this is something that's not really been discussed, and it reflects the situation right now. The Maharashtra government is dealing with the situation now by having many containment zones, 64 zones, where almost 4.2 lakh people are presently contained. Why? Because there has been an outbreak. And the overall numbers, almost 20 lakh people are in sealed buildings, sealed floors, or in containment zones right now. In containment zones, 4.2 lakh people at this stage. Now, if you look at sealed buildings, what are sealed buildings? 5 or more active cases, 578 buildings have been affected, 2.7 lakh people have been affected over here. They are contained in these sealed buildings. Imagine about what their situation would be at this stage. But it's important because it's protecting a lot of people. And as many as 11.8 lakh people on sealed floors. What are sealed floors? They have less than 5 active cases. 7,475 floors right now where people again are being contained. Now, if you look at this data, and where are we getting this data from? It's actually the BMC, the Brihan Mumbai Municipal Corporation, the municipality. This is important because this gives you an idea of the jump in the last couple of days. On the 23rd of March, if you look at the 9% jump, the surge to 512 in critical cases in Mumbai, which have gone up sharply in 24 hours. And from 512 on the 28th of March, it's now gone up to 556 in 24 hours. So this is a spike in the number of critical cases, and this is something, again, which reflects the situation. Finally, and this is what our topic really is, the overall capacity in hospitals. Now, again, as I started in this program, this number will be surged in the next couple of days, but at the moment, the total capacity of Mumbai in terms of COVID beds, 13,006 COVID beds, not all beds, I'm talking about COVID over here, 9,789 occupied at this stage, 3,217 vacant at the moment. ICU beds, there's a capacity of 1,709, 1,261 are presently occupied, vacant only 448. Mumbai is a city of 20.6 million according to some estimates. Keep that in mind, a city of 20.6 million. And here's where it starts getting really worrisome, because the capacity of oxygen beds, the numbers of beds available, 8,694. What is vacant is 2,174. But again, if you look at this and say this is a city of 20.6 million, then that becomes problematic. And this is the one statistic which is perhaps the most worrying. At this stage, as of 10:03 this morning, the 29th of March, because that's the latest number, only 226 beds with ventilators are present. That's it. There were 1,036, 810 have been occupied, 226 lie vacant, and in that 226, the large number of them, right, are in government hospitals. The public, the private hospitals are just a distinct minority of those that lie vacant over there. Now, again, asymptomatic versus symptomatic cases, most of those who are testing right now or who have been detected, as many as 81% are asymptomatic, 18% are symptomatic, 1% are critical in terms of cases. Now, that asymptomatic number is important because if people are asymptomatic, by and large don't have any symptoms, then they're out there in the open with a possibly more transmissible mutant variant now doing the rounds, possibly infecting other people. So those are the numbers that we are looking at this stage. I'm joined now by the senior Congress leader, Milind Deora, who's with us. Milind, thanks very much for being with us this evening. Now, you've been tweeting something fairly interesting. You've been talking about the pressing need, in your opinion, to vaccinate not just 45 plus, but as many citizens, adults, as possible. Do you believe that this should have in fact started a few weeks back, because we knew about mutant strains back then?
Well, I believe that the vaccination, the entire vaccination process all over India has certainly, we started a little later than many other countries in the world. I mean, if you look at Israel, for instance, they've achieved a hit rate where every single person in the country has received at least one dose. The United States has crossed about 100 million people. They are vaccinating close to 2.5 million people per day. And I do believe that countries that vaccinate their populations as quickly as possible are the ones who will be able to open up their economy and save more lives and livelihoods. So in that sense, I think that India still has an opportunity. We spent a lot of time, donating vaccines all over the world. Unlike China, whose vaccine diplomacy was about selling vaccines to needy countries, our vaccine diplomacy was one where we donated vaccines to different countries, and I'm fully in favor of that. But I do believe that now, better late than never, it's time we re-energize our focus across the country, but more specifically, because if you look at my last tweet, and if you look at yesterday's numbers, 60% of cases in India, new cases in India, are emanating from Maharashtra.
Yes.
And the top 5 cities, I think, in India are cities in Maharashtra. In Pune, between Pune and Mumbai, for instance, they account together for 22% of national cases across the country. So I believe that if the government of Maharashtra, the local municipalities in these affected cities, state governments in other cities like Delhi and even in some Kerala cities that are affected, and the government of India just focus on these hot zones, really, because these are the same cities, mind you, that were very badly affected in the first wave. So clearly there is a problem in terms of the population density of these cities that is leading to a second COVID surge, as we saw in the first surge. And I think if we re-energize and converge all our efforts and all governments come together, keep politics aside, and ensure that everybody, every adult above the age of 18 is vaccinated as quickly as possible. You do that in many, many ways. One way is certainly to decentralize the vaccine rollout, make it far more accessible and easy for people to, we should get to a system where you can go to your general practitioner, your GP, in congested areas, there are small clinics, and that doctor should be able to administer a COVID vaccine.
And should
obviously
people be
keeping
allowed to buy it, Milind?
Keeping certain precautions in mind.
There are millions of citizens, Milind, who would say that, look, I understand it's a crisis, I'm willing to pay for it, and therefore let's roll out the availability. It's a disaster at this situation across the world. So what's wrong with people paying for it if they want to? How does that take away from the government's plans of giving it free to those who cannot afford it?
Well, I think paying is something which, if you do it in a private hospital, for instance, somebody can go in and pay for it. If you do it in a government hospital, let's say in Mumbai city, There are government hospitals like Nair. There are government
at a
hospitals like
subsidized
JJ.
rate, right? The rate right
Where you
now
can get
is
it free, you
subsidized.
can get it at a
If there were many more vaccines available, for
Breach Candy
example,
Hospital,
Pfizer
for instance,
or
somebody is willing
Moderna,
to
all
pay
of
for
these,
it,
and people were willing to pay, then what's wrong with it?
Yeah, I think the question is not who pays for it. I think the government of India has made it abundantly clear several times that they want to provide free vaccines for the citizens of India. So I don't think payment is an issue. But I do believe that the government of India's process of keeping it very centralized, first the first health responders, which is very, very important to do. We support that. Then moving to those above the age of 60 and people above the age of 45 who have comorbidities, now relaxing that and saying anyone above the age of 45, no questions asked. I would say again that if you just pick the top 10 cities in India, many of those are from Maharashtra, and you look at those cities in the second surge, and you compare what happened during the first wave, they are almost the same cities. Mumbai was very badly affected during the first wave. It's very badly, it's one of the highest cities in India today during the second wave. So if the government of India, in partnership with the state governments and the municipalities, puts all its effort into these cities, vaccinates 70, 80, 90% of the population, the adult population, I think then you'll reach a stage where you will have herd immunity. Because mind you, in a city like Mumbai, during the first wave, and I think up until September when India's COVID numbers and curves started to flatten out, there were several serological surveys done by many institutions, private, government, and they determined that in certain slum pockets, which are extremely congested, where people have shared access to a toilet, for instance, 65 to 70% of people had antibodies, which means they've already had COVID, and in some ways they're protected. So it's not going to take many more vaccinations for people in Mumbai to attain herd immunity.
All right.
And my only point is that I'm not saying that we should focus only on Mumbai and leave the rest of the country out. I'm saying that these 10 cities
we should focus on cities and areas which are affected.
These 10 cities ultimately, look, they're not happening because of failed governance or because the government has the wrong policies. They're happening because they are very densely congested cities.
Correct.
And in the same case, for example, New York. New York was the worst affected city in America because it's a congested city. It's dense, it's packed. And as compared to other parts of the US. So if the government of India, I think, rather than just generalizing and saying we're having this national rollout, which you should do, if they relax it for a city, for states like Maharashtra, allow states to self-determine whether they want to allow those above the age of 18 to get vaccinated, that's something which should be left to state governments, because different states have different dynamics at play. And different states are battling the second surge in a very different way from other states. And you should leave it to local municipalities and states to determine what works best.
Fair enough, Milind. I think you've raised an important proposition. Perhaps a lot of us should have actually highlighted some of those points. Thanks so much for being with us. I want to focus a little bit on the hospital situation now. I'm joined by Dr. Rajesh Parekh of Jaslok, Dr. Shahid Jamil at Ashoka University, he's a virologist, and Dr. Abdul Samad Ansari, who is with Nanavati Hospital, and Dr. Mufassal Lagdawala as well. Dr. Parekh, let me come to you first. At Jaslok, what is your situation in terms of COVID bed availability?
Not so great, Vishnu. Always a pleasure to be with you. I personally have been finding it more difficult to get a bed this time around for people who've been contacting me than in the first wave. But if I may, you ended your last interaction by saying that perhaps we should have warned about this earlier. I don't think any of us need to feel guilty about that. I think we have warned about this for quite some time now, for well over a year. And if I may just share a graph with you, it'll make it amply clear that while we may have been talking about it for a year, history has been talking about it for well over 100 years. So I'm not sure if this can be seen clearly.
Yeah, let's zoom in. Let's go full frame to him.
Yes. So while he's moving into the full frame, you'll see here a graph which we have published twice. Initially in our first book on the coronavirus, which we published last February, and more recently this year, early this year, in the vaccine book. This is something that we've been talking about for a while. Pandemics, like tsunamis, do tend to come in waves.
Okay.
It's an intrinsic feature of viral pandemics, at least, that more likely than not, there will be a second wave. And we warned of this in January. In December, I wrote up a policy paper predicting the situation exactly
sure. I just want to interrupt you because I really want to focus on the immediate situation. Dr. Ansari, what is the situation at Nanavati right now in terms of bed availability?
So we are definitely, Vishnu, going through a tough time again after a lull of nearly 4 to 5 months. This is definitely for the past 15 days, definitely becoming difficult. We are finding and struggling for beds. But I would, rather than giving a brief answer, I would like to, go back, rewind that what we need to do, which we were doing in the beginning when there was a major surge in September, is to look at identify, triage and treat, ITT. Unless we do it properly, we will be not looking down the funnel. The funnel is...
We'll fix that line with him. Let me go across to Dr. Laktawala. Sir, as the advisor to the BMC for COVID jumbo facilities, how is the state government surging the availability of beds, increasing the number of beds in the next, say, 5-10 days?
Vishnu, there are two things, aspects of this kind of second wave of the pandemic. Firstly, it is infecting and afflicting more of the affluent class, someone from the high rises, rather than the slums of Mumbai. And that's why you are seeing that a lot of the private hospitals have run out of beds when the BMC still has a lot of beds to offer. So my advice would be that please go out and get whatever bed you can at the beginning. Another thing is how many ever beds the state government and infrastructure can build up. Where are you going to get the doctors, the nurses, the healthcare professionals? Because I think people are a little tired after 1 year of battling this. So it's going to be tougher this time around. And I think the challenge is that any kind of healthcare infrastructure, if there's a sudden surge, is going to be overwhelmed. And I hope that very soon we can overcome this kind of wave, second wave.
Dr. Jamil, if you look at the numbers in Mumbai, the positivity rate, the R factor going upwards, the fatality rate as well, is it possible for you as a virologist to actually give us an idea of how far this may be headed so that we know when we may be potentially getting close to being overwhelmed at our hospitals?
Well, it's certainly worrisome at this point. I can't predict how far it will go. Viruses have a tendency of proving you wrong again and again. But if you look at the rate of increase in this second wave, all over Maharashtra, all the top 5 cities in Maharashtra, the rate of increase this time is much more than the rate of increase that we had in the months of July, August, and September. Something that was just said makes a whole lot of sense, that this time around it's people in high rises. These are the people who did not get infected, susceptible. So while we're talking about parts of Mumbai having 50, 60, 65% exposure, there are pockets in the city that have remained unexposed. And now the virus is going in those pockets.
Right.
The other factor that is important here is that from all over Maharashtra now, about 20% of the samples that are being collected, we are finding mutants.
Yes.
And there are these double mutants that have the ability to infect better and the ability to partially escape immune responses as well. So it's multiple things really coming together, and that's why this rate is skyrocketing.
Dr. Ansari, do we have any clarity at this stage on the increased transmissibility of these 2 mutant strains, which each have 2 mutant variations inside them?
So I can only add at this point of time that definitely the infectivity may be higher, which is what we are also perceiving, but the mortality has not increased, and I want to underline that the mortality, if at all there is an increase, is because of the total burden of cases. So if you had previously, let's say 1,000 cases a day, and when you look at 5,000 cases, just statistically your mortality number may look more, but the but the case fatality ratio has actually not increased. In fact, right now we have less patients on invasive mechanical ventilation as before, and probably over the last 1 year, we intensivists and everybody has learned that the key is to be as less invasive, identify, triage, have an algorithmic approach to treat them, and your mortalities do come down. But yes, I completely understand that we should be capable of taking the surge capacity, and we need to escalate the number of oxygen beds and monitored beds rather than invasive ventilator beds. And I would like to correct that. The numbers which we have right now, our ICU beds capability went up during the peak time to nearly 50% more than what were the numbers, because we had a lot of makeshift beds where we did manage NIV ventilators, and they were as good as capable ICU beds. So I think the situation is not as dismal, but we need to be careful, very closely monitoring, and we need to have a central way to look at the sickest of the people who should reach the ventilated beds or the ICU beds, rather than people
it would also
coming
help
over there
if
who
people
have
who are
mild
sick
symptoms.
on a real-time basis knew where they could head to get to a hospital with the facilities they need. In Delhi, this is there. But I tried all day to find something updated on a real-time basis, an app. I couldn't find any for the city of Mumbai.
Had the war zones. I think we had an active war zone strategy at that point of time, which is still very much active, but unfortunately the number of beds, because of increasing surge of non-COVID patients, probably must have been, kind of looking as if it's only 75% occupancy. But I think the availability of beds is not the real determinant right now.
All right. I'd like to thank you all very much for joining us. We'll be keeping a close track on developments in Maharashtra and Mumbai, of course. I'm going to quickly move on now to our other big focus. The world is looking very, very closely at Myanmar and the genocide, or some reports of the genocide in that country. More than 100 people were killed over the weekend by the military junta, the humanitarian situation becoming far more critical. Does India have a bigger role to play at this stage as the world's largest democracy? Well, joining us now, Kwe Mo Tun, Myanmar's envoy to the United Nations. Thank you very much, sir, for being with us. My first question to you, there are reports which are now coming in fact confirmed reports, that various state governments, for example the government of Manipur in India, has issued orders to district administration officials saying that food and shelter camps should not be provided to refugees from your country. Is this something that astounds you? Is that something that worries you, given what we are seeing in your country?
Thank you. First of all, I'd like to thank you for inviting me to this program. Of course, we have really concern on the situation, horrible situation happening in Myanmar. So we keep saying that the people of Myanmar feel helpless. So we really like to seek the protection from the international community. So when we are talking about protection from the international community, whoever can protect the life of the innocent civilians in Myanmar, whatever way that the international community can. So providing shelter, providing the food, humanitarian assistance, as well as the stronger possible measures from the international community, including imposing targeted sanctions on the leaders of the military and its company, the institutions, and the business of their relatives. So that's sort of things that we really like to receive the support from the international community. If we can go further to look at the all the financial link between the military regime and the others and the businesses in the other country, but look at it and get it off right away. That is what we are really looking forward.
Sure. Ambassador, let me ask you this. There is a refugee situation which Myanmar faces. We were told that the junta actually employed aircraft to attack villagers fleeing to Thailand. And now on the India side as well, there are lots of people who've tried to come into my country, but perhaps not many more would like to do that. And that perhaps is not being permitted right now. So what more do you want Thailand and India to do?
Sorry, say again.
What more do you want Thailand and India to do right now?
Yeah, so because Thailand, India, they bordering, they are the bordering countries, and we really looking forward to one. I thanking the support extended by our neighboring country, namely the India and the Thailand. But because of the situation that we are facing, the people, innocent people, need to find a shelter. So what I like to request is that whatever the support that they can make to protect the people, give the shelter to them, we really like to appreciate them. So we really looking forward to receiving strong support from our neighboring countries, namely India and Thailand, to support the people who are really in the dire situation. So their action from our neighboring country is saving the lives of the innocent people. So that is why, if I may, I like to request the government of India, the people of India, and also the respective regional governments to provide shelter to help them. That is the saving lives. So because we are facing the humanitarian situation, we are facing the crimes against humanity committed by the military regime. So we're really looking forward to receiving the strong support from India to protect the people, to save the life of the innocent civilians who are seeking the shelter in India.
Right.
So please,
right.
Please help us. Please protect them. Please save life of our innocent civilians.
We will try and certainly
really
convey that message,
us.
and I'm sure a lot of people over here in the government are looking at this carefully. Thank you very much, sir, and we'll have you back on the program later on. This is an issue which we will not forget. Myanmar is not forgotten to us over here in our country. Thank you very much, sir, for being with us.
Because we have the very long history and good relationship. So we're really looking forward to having, the support from the India.
Absolutely, sir. Thank you so much, sir, for being with us.